Hello, I'm Dr. Sha-Rhonda Green. I'm a mental health therapist and a social worker. I've been a licensed clinical social worker since 2004. I provide online therapy for Black women in a virtual environment, and I will be providing my website and a booking link if you are interested in engaging in mental health therapy. Today, I want to share with you about navigating some common challenges or discomforts in therapy. And give you some tools and tips to navigate this journey that you have set upon. So I want you to keep watching, and I'm going to give you some insights and tips. And please share your comments or questions in the comment section. So the first discomfort may be a fear of vulnerability. Uh, it's when if you've been to therapy before, or if this is your first time going to therapy and you're like just have started over with a new therapist, there may be some fear of vulnerability there, and that's connected and related to uh, wanting to build trust, as well as past experiences of having trust and vulnerability in different relationships. What is really important is to notice what your self talk is. What are you telling yourself about the experience? Are you catastrophizing? Are you predicting the end most horrendous result about this? So, what you say to yourself and how you're talking to yourself impacts your feelings and also impacts your behaviors. Um, Practice just self compassion and acknowledging that vulnerability is a sign of strength. And that is counter probably to all the things that you have heard and you've said. And when you've probably been vulnerable or probably asked for your needs to be met, someone probably has attacked you or shamed you or blamed you or guilted you. So just want to encourage you that it is normal to have some fear of vulnerability. Difficulty opening up. Start small. Start with what feels comfortable to you so that you can also build trust. Share just minor concerns or feelings that come up for you that you feel comfortable telling, and you can just kind of build upon that. There's a fear of being judged or labeled. Like I said, your past experience of trauma or betrayal. You may only know about 4 or 5 words: mad, sad, glad, and bad. Usually in this particular situation, what I do, I use the feeling wheel a lot, and I will share that resource in the bottom of this video as well, for you to be able to look at and increase your emotional vocabulary, so that you can have some more creative ways of expressing yourself. You might write, you might journal, you might draw to help convey your emotions. You might describe your emotions in colors and sounds and textures, or say my chest is feeling as heavy as 5 elephants sitting on it. And that's a way to express and to give color to your emotions. Practice mindfulness. When you're feeling difficulty opening up, just practice mindfulness and encourage yourself and talk to yourself. It's okay. It's okay to feel overwhelmed. It's okay to feel this. I'm learning how to express my emotions. I'm opening up maybe for the first time. A discomfort or challenge number 3 would be feeling stuck or unmotivated. Uh, it can hinder your progress in therapy, and it also could indicate to the therapist that you may be in a different phase or stage of change. There there's theory that supports that sometimes persons are thinking about change, kind of being your pre-contemplative stage of thinking about change and looking at the pros and cons, and you might be in therapy, but you're still you're still feeling a little skeptical about it. It's really important to identify your negative thought patterns. Your therapist will help you to do this, and to also set realistic goals and celebrate your small victories, celebrate your small wins. Discomfort number 4, fear of emotional overwhelm. So, therapists are trained to help you manage your emotions as well as provide a safe place for you to express your emotions. One way to continue to do that is emotional regulation strategies like journaling, breathing, not breathing, creative expression, physical activity, deep breathing, some grounding techniques, some sensory integration things, and also practicing how to build a supportive network of loved ones, of friends, of support groups. These are some ways to ground yourself and to practice dealing with when it feels emotionally overwhelming. And another, some other tips and reminders is to emphasize self-compassion. You are a human being. You're having a human experience. It is normal to feel overwhelmed, and feeling overwhelmed. Sometimes it's just like riding, like how you see a wave on the ocean, like a wave. It feels like it's going to overcome you, and you're standing safely on the beach, and the wave may come over you, but it may not consume you. Um, and it feels like that, especially when you've been talked out of your feelings all your life, when you've been afraid and you had to push that on the inside, or press through, or suck it up, or run away, or fight, like physically fight. So those are normal flight or fight of responses when you are experiencing discomfort, and your body remembers all the times that you've been uncomfortable. And so you may feel that pull, that tug. You may feel numb. You could feel a variety of things, but just communicate openly with your therapist. Your therapist is trained to kind of notice your affect, like kind of how your body, how your face, those types of things too, are what's happening in the session, so that they can help you to process that and reflect that back to you and support you and help you to breathe and help to ground you, and encourage you to continue to work towards your goals. And sometimes that means a goal modification. It could mean that. It could mean pacing yourself a little bit more. And that's fine. It's about finding your rhythm and also practicing how to ask to get your needs met. So I am Dr. Sha-Rhonda Green. I'm a licensed clinical social worker. I've been practicing since 2004. I am passionate about helping Black women heal, to become empowered, and to become resilient. If you have questions or comments, please share them in the comments area, and I look forward to sharing in the future. Have an amazing day.